Good day. My name is Vera Lanteln-Vezan, and I'm a coordinator of the European Equine Facilitated Therapy Network. It's my great pleasure to introduce you a group of passionate, knowledgeable, and friendly therapists in equine facilitated therapy. EFTEN was founded in April 2019 when I invited my colleagues and friends to Prague, Czech Republic, to meet and discuss possibilities of cooperation, sharing, and exchange our ideas. With the vision to promote the best practice, further research, education, and development of our field. Currently, we have 34 members from 17 countries. As Europe has 43 countries, there is still room for anyone who would like to join us. How do we cooperate and share? As you can read the thoughts of my colleagues, it's quite simple. We like to meet and discuss our passion, and it is the equine facilitated therapy. We found it very worthwhile to discuss our ideas, our thoughts, and also to support each other, even in these difficult times due to COVID. We developed several subgroups. One of them is education, very busy subgroup, working on setting standards and competencies for physiotherapists and occupational therapists in EFT. Second group, reserving the knowledge, is working on case study guidelines for EFT educational courses within Europe to get data for future studies and research. Best practice group creates an online resource for all therapists working with horses as their therapeutic medium. The outcome you can already see on our website as a list of EFT equipment and tools. Case study presentation is the recent group. It's a safe space for therapists to share their work, the case studies, sharing the videos, and introducing interesting working approaches, or to ask colleagues for advice if there is a difficult diagnosis. In 2019, we managed to meet in Prague in person. The next meeting was scheduled in March 2020 in St. Petersburg. Unfortunately, we had to cancel due to COVID, but we started to meet via Zoom. So far, we met for 6 times for the general meetings, and for the educational meeting for physiotherapists, we met for 10 times. We communicate via email and via WhatsApp, what is the most suitable communication settings for us. For our group, the EFTEN is an inspiration for learning and networking through open-minded collaboration. We would like to inspire you to join us if you are a European therapist, or to inspire you to create such a network on the place where you live.
I'm going to talk you a little bit about equine facilitated therapy education we have in Finland. Our education started at 1988, and it is a multi-professional education where a basic education of a therapist is required. Also, a work experience is required. In addition to your basic profession, you need to have equine riding skills and good handling skills to be able to enter to the entry test. And if you pass that, you might be in the group of getting into the education. Our curricula is recognized in the governmental level. The role of the student is an active learner, and the modules where the studying is completed, the length and intensity varies. The key competencies are learned within the modules and in the assignments that the students are doing between the modules. Our students and also our teachers are using the latest research in the field. Our students also write 3 case studies using the form of academic writing during the education. Also, the final assignment, the maturity work, is written in the form of academic writing. We now have the collection of over 20 years of academic case studies. The outcome for our education is for the student to be able to assess and set the goals for the client and also for the training for the horse. We are utilizing the international classification of functioning when setting the goals for our clients, as physical therapists are the experts in functioning. Our students also learn how to be able to utilize the equine movement on its best for each client, and so that it fits their functioning, and to fit the tack so that it's suitable for both. Our students also learn to documentate and feedback to the referrals and hospitals of the patient outcome measures and progress. They also learn multi-professional networking, which is a requirement for rehabilitation, at least here in Finland. The quality and safety are taken care within the sessions of therapy. And our students also learn that lifelong learning is essential to keep up with everyday practice.
Hi, my name's Joanna Parsons and I am a specialist paediatric physiotherapist. I'm also an equine facilitated physiotherapist, and I am the ACPI International Officer. ACPI is our professional network in the UK. It stands for the Association of Chartered Physiotherapists in Equine Activity. And I'm going to be talking to you about practice and how it relates to research and to education. I just wanted to start off with just sharing some examples of practice in the UK. I'm very aware that practice varies throughout the world depending on different situations in different countries. And in the United Kingdom, the government and the National Health Service does not currently pay for equine facilitated therapy. So many therapists are currently sole traders. They have private practices. They might work for a charity or work within the Riding for the Disabled Association, sometimes using their own equines and sometimes using equines from a commercial school. So recently in the UK, we have been having students on placement. This has been quite a great development in our practice, and it has helped make education of therapists much more relevant to practice. Having students on placement can show students real life examples of case studies. It can give them ideas for how they might run their own equine facilitated therapy practices. It also helps clinicians to improve their practice through teaching, but also through their own clinical reasoning, and also through their own reflective practice. And it also creates a link from the student to the practitioners, and so when students go off to perhaps start their own practices, they have a natural mentor or somebody that they can contact that might help them with their clients, their caseload, or with the setting up of their practice. Research is also really relevant in practice. It is practitioners that often can showcase their case studies, and where these case studies are conducted with good outcome measures, with standardized outcome measures, and where they follow a best practice example, they can be brought together to create a case series. And where there are many centres that are using similar or same outcome measures, these can become, we can create multi-centre case study designs, which actually is very good research and will help to promote our practice. As physiotherapists, we should also be very keen to develop practitioners' research skills, so that it is practitioners who are doing the research, as this will make research much more relevant to our practice. So within the European Equine Facilitated Therapy Network, we like to we've created a model of collaborative learning where people are able to share their practice, where they feel that that this is a safe space where practice can be shared. These case studies we've conducted via Zoom, so travel isn't an issue. However, it does mean that we are able to share best practice, we are able to discuss and also think about, kind of analyse and thinking about what outcome measures can be used and how to improve each other's practice. We are able to learn from each other. Within the EFTN, we believe that every therapist has got something to offer, and that we can all learn from each other. It also helps to create best practice examples, where these best practice examples can be used throughout Europe and internationally. So I hope that has given you something to think about in terms of how practice, education and research are all relevant to each therapist within their own practice. Thank you.
Hello, my name is Dorothy Debuse, and I have the pleasure of taking you through the research aspect of the recent work of the EEFTN. There are several themes which we have been discussing, and these include online training and sharing of expertise, the selection of outcome measures in practice to facilitate research, the promotion of practice-based and practice-relevant research, and the creation of an online research resource or a repository. And I'm going to share with you just some of the topics within these themes that we have been talking about. So some of the topics discussed so far are students' final case studies. In a lot of countries, we've found case studies are a common final assessment or assessment as part of the equine facilitated training. So we are wanting to investigate whether we should perhaps develop common guidelines whether we should encourage students to submit their case studies in English so that people from different countries can share case studies in a language that is common to all. And finally, we are very keen for practice-based topics to be dealt with in those case studies to make them as relevant as possible. We've also been sharing expertise and training, and more recently this has been online. So we're finding that research, including students in one country, can benefit from the expertise of people in another country. And this could even include cross-border supervision of research projects, but also advice between practitioners in practice and in research. And a big topic is also the facilitation of ethics approval processes, because one challenge we all have in our field of work is that the people we work with are vulnerable, and often they're also children. And working with both vulnerable people and children combined is a very, very difficult thing to get through research ethics committees. And so this is a very important area of expertise that we're keen to share so that research applications can be successful. Other topics are the selection of common outcome measures, because they would facilitate the comparison of results. They would also allow the pooling of results from different case studies or studies. And that ideally would increase the power of research findings beyond that of case studies and other very small scale studies. And as I've been sharing with you in the Congress in Dublin, RCTs, randomized controlled trials, are really not a good model to use in our field of work, because we have clients that are so diverse that it is not possible to have big numbers of participants, like in drug trials for which RCTs have been designed. So case studies and case series designs is much more appropriate. And so the selection of common outcome measures would really facilitate this sharing and pooling of results. And finally, we are in agreement that research must be relevant to practice. And so we've been lobbying for researchers to be active practitioners, or at least to have practice experience. And there is a very good example from Sweden, where in fact 11 practitioners are also researchers at different universities. So there is a real dovetailing of academia and practice-based research, and that is a wonderful thing to share. Thank you, Megan. So last but not least, how does networking then enhance research? First of all, I would like to say that we all stand on the shoulders of giants. We do not have to repeat the same studies or make the same mistakes as others before us. We can learn from each other and build on what we each are doing. And also by researching what's relevant to practice, we can actually make a huge difference to practice and to people's lives. And that's a wonderful, it's a wonderful gift to have. Now, hippotherapy students can also be linked up to relevant topics which come from practice, which could come from education. And also in return, education and therefore practice is up to date with practice and research. So everybody really is in a win-win situation, which is a wonderful thing to be. And I would encourage us all to engage more in networking and network beyond the individual country borders on that basis. And on that note, I'm very happy to hand back to Megan. Thank you.